Thank you very much, especially thanks for this introduction. So it's really great to be doing this presentation today at Geary. I thank you, Dorian, and also Michelle for the invitation, and also David and Mark for organizing everything. So today I'm going to present the main findings of our work in progress for the next 30 minutes. And about this paper, this paper focuses on housing policies that were implemented in the context of the COVID-19 pandemic for several different reasons, but mostly they were designed to act some kind of a buffer to the main consequences of the pandemic and especially helping people to stay in their homes. So I want to start by giving a bit of a background to this research. First, as we know, there is a well-documented association between housing and health, and these mostly include elements of housing stability, like housing quality, safety, affordability, which are all central to the term health and well-being. And the fact that a high number of people live in inadequate housing conditions, it was extremely concerning, because having a place to stay during the health restrictions was essential to control the spread of the virus. And even if not all countries, they had shelter-in-place orders, those who decided to recommend it, they told people to stay at home. But for some people, it was not possible. So this recommendation to stay at home, with its own hashtag, for example, stay at home, highlighted how a chronic lack of safe housing, and especially affordable housing, is one of the biggest drivers of health and wealth disparities in our society. And it also brings to light the idea of having an actual home to stay, because how can people practice physical distancing, quarantine, and isolation without a home? So another thing is that it also brought to light this idea of a home as a space where people are ontologically secure, meaning a place where people feel safe and secure and in control. So we stay at home was the safest option for some people, for example, but for those experiencing domestic violence, it wasn't the case. So having a place where you are secure, it's extremely important. And this was something, this is an idea that was brought back by those discussions. And this is especially true for groups who are more vulnerable, such as those people who are experiencing homelessness, because they face a higher level of exposure to the virus. So, and it's also important to think about the distortion or the changes when you think about the concept of home, since we are in the middle of a housing crisis, especially when we think about the financialization of housing, where housing is no longer seen as a home, but rather is an asset or a commodity, where a big proportion of people, they are excluded. So they are excluded either because they cannot purchase a home, or because paying the rent consists of a cost that is just too high. So the pandemic highlighted the health implications of housing. It is also interesting to note that the pandemic took place or is taking place amid this very severe housing crisis in many countries. So, and when we see poor housing conditions, just as overcrowding and high density, they are normally associated with a greater spread of COVID, and people have had to spend much more time at home in homes that are overcrowded, sometimes damp or unsafe. So, and the fact that COVID-19 has exposed even more the contradictions of housing financial models, which are based on profit, this is only one of the main elements telling us how years of neoliberal policies has left national governments fully exposed and dependent on the private sector to provide essential service, just as health and housing. But even then, governments, they had to offer a response, even if they struggled to offer one. But because housing and home, the idea of home, is now at the center stage of the strategy to protect people from the virus, states and countries, they had to intervene, and they had some of them, they had to act very quickly. In some cases, they were not able to be as quickly, but some was there surprisingly fast. So the central idea for some housing analysts or housing researchers was that those policies, they should be able to protect the right to housing during the pandemic, because adequate housing is crucial. It's crucial for positive health outcomes. But the thing is that not all policies, they came or they elaborated with these human rights framework in mind. Sometimes it was more about a strong social pressure to act on the economic consequences than policies were who were more aligned with human rights. But the fact is that protecting the right to housing during the pandemic is key. It's a key element of the responses for recovery measures during and after the pandemic. So just a little bit about on the policy context. So this is a context of crisis where we have two crises, the health crisis because of the pandemic and the housing crisis. And in this context, something interesting happened, which was that we started to see more progressive approaches in the promotion of housing policies. And that they're considered by some more conservative groups too radical in the pre-pandemic time, but they had to be enacted very quickly, especially on lockdowns and shelter-in-place orders they started. So those policies, they're not just rapid fire, but they're at least some of them, they're substantial housing policies, and they were created to respond to the challenge of COVID. So some of it would, or at least could, hardly be implemented before the pandemic. But then what some people would say that was politically impossible in some countries, they became impossible. Sorry, they became possible in a matter of days. So the best example I can think here is of this implementation would be the rent freeze that was implemented in Ireland, for example. It wasn't possible because there is some constitutional limitation, but then it was possible during the lockdowns, and then it's no longer possible again. So this is a very debatable topic, but this is, I think it's a good example to show that because of that particular situation, that policy was implemented. So some of those policies, they implicitly acknowledge that some of the long-term structural deficits of housing system, they were attended, they were addressed, but they're very temporary in their nature. So just to comment a little bit of on my methodology, just give me 1 second. So just to present a little bit about my research aim. So the first idea of this study is to describe the key actions implemented to promote housing stability and increase compliance with health restrictions during the pandemic. This is core to the study. And the second aim is to examine housing solutions to protect vulnerable populations and some of the gaps found in pandemic housing policies. So this is in the end very policy-focused piece of work. I generally went about this from the outset by deciding on the time frame of the policies to be examined. And so in this case, the research covers the first wave of the COVID-19 pandemic from March to July 2020. And the main reason for that is the availability of data. And to this purpose, I compiled data from the UCD, which is the Organization for Economic Cooperation and Development, and also from FEANZA, the European Federation of National Organizations Work with the Homeless. So those two institutions, they have created data sets that they give us good policy data, even if they are not exactly granular or not granular enough. It's useful for the purpose of this research, especially because there is a lot of variation between the policies implemented when we compare countries. So I had to decide which policies are most relevant So for this, I used the United Nations COVID guidance notes to help me to make this decision, because they make recommendations on policy measures related to housing for countries to adopt. So I used those as my main benchmark. So turning now to the results, most of the policies implemented, they were addressing economic component. So those were basically protections and policy measures to prevent housing, especially housing displacement and evictions, as a key component of the public health strategy. So there are different ways to examine those actions, such as to whom they are directed. To whom they are directed. So, for example, some of those policies, they're directed to for renters, for homeowners, for people experiencing homelessness. So, and I try to divide those actions in 4 clusters, around 4 axes. So the first is the measures to protect the homeless, then measures to support the renters to stay in their homes, and measures to help homeowners to maintain their homes. So, and those are the ones I focus on the remaining of the study. So here in this graph, I have a summary of those key policy measures, and each includes all the 37 OECD country members. So most of the supports available, as you can see, they were directed to tenants and homeowners. So the path chosen by most countries was to implement specific policies to support tenants and homeowners, in addition to letting social safety nets play their roles with social benefits payments, for example. So for tenants, the most common measure were the suspension of evictions and the extension of rent contracts. For owners, it was the mortgage forbearance, which is when mortgage lenders, they allow people to make a lower payment or to pause paying their mortgage. So there is this other category where we have the provision of homeless shelters and also supports to the construction sector. But this last one, the construction sector, it's not in the scope of the paper. So the idea here is just to offer a rough view, a rough idea of how those measures they're distributed. And I speak about them in more detail next. So the first measure I want to speak in more detail is about the provision of emergency accommodation for people experiencing homelessness. This is relevant, especially because the homeless population was initially badly affected by the coronavirus. It was the most exposed group. So in various countries, people experiencing homelessness, they stay in congregated setting, meaning that they share a space with several other people. But because of the pandemic, decreasing this density was essential. So most of the policy for directed to those groups try in some way or other to control density. So it was done in most of the cases with the provision of dedicated accommodation for self-isolation or quarantine. It was obviously challenging, as in many countries, homeless accommodation are managed at the local level. So those local authorities, they had to have a very good level of coordination among them to provide this service. So something that was done in several countries, it was the acquisition and the repurpose of hotels. That it's one of the most novel solutions that I found in this research, where local authorities, they removed rough sleepers, which are people who sleep outside or on the streets, and they put them in hotels or hostels they were in some cases completely empty because of health restrictions. So it was, some people would say, a win-win situation, because the hotels were being kept busy with the homeless who were staying there, and the homeless had a place to stay. So it was a temporary solution, but the whole point was to keep people able to isolate and do quarantine as needed by providing a safe space for them to stay. So overall, we can say this was an improvement to the service that were being offered, especially because some hostels, some homeless hostels, they're only open during the day. So people, they have to stay somewhere else. Sorry, they're only open during the night. So people, they have to stay doing something else in other places during the day. So in those cases, those hostels, they started to work 24 hours per day. So it made a big difference for a lot of people, in addition to not having the congregated settings no longer. So the next one is Abdebeno Evictions, which was also one of the most popular measures to promote housing stability. And this one was implemented in more than half of the OECD countries. And this one was particularly relevant because the risk of eviction was increased, or even worse, during the pandemic. So this temporary suspension of evictions was critical. It was a critical measure to help families to stay in their homes. So how did exactly this work? In most of the cases, it was a prohibition of evictions due to missed payments. So some people, they would defer the payment of the rent, or it included sometimes a temporary reduction of rent, or even the suspension of rent, depending on the country. So these included not just evictions in the private sector, but also in social housing and in the bank mortgage sectors. So where a bank was going to proceed with repossession, they could not go ahead. So some countries that they implemented eviction bans were Australia, Belgium, France, Ireland, Luxembourg, Netherlands, Spain, UK, US. There are several others, just want to give you some examples. So, and the data on the impact of these eviction bans, they are not readily available, but initial research has been showing that where eviction bans they are implemented, these led to lower infection rates. So this is something very positive to me. But of course, this eviction moratorium had some limitations, which, among other things, aside from being short-term, it only applied to new evictions. So if a household had an eviction process underway, these would not affect them. They would actually be evicted if the eviction process started before the health restrictions. So in the end, some evictions did happen during that time. The third measure, it was the prohibition of increasing rental costs. This was important because tenants in the private sector, they do face many insecurities, including uncertainty about their capacity to pay the rent, and also, depending on the country, very weak tenants laws. But even if people they lose their jobs and are facing hardship, they are expected to keep paying the rent. So when this type of rent control was implemented, it was done mostly by extension of contracts and with the maintenance of rent prices for a specific amount of time. So some of those measures include rent freeze, automatic contract extension, flexibilization of rental benefits, which means having more flexible criteria, so to be more inclusive, rent payment delay, and extension of contracts. So some of the countries who implemented this measure, aside from Ireland, there are Germany, Austria, and Portugal. And some other countries, they decided to implement rent reduction. So it was not just put a rent freeze, but actually reducing the rent in the most critical phases of the lockdown. So at least in my interpretation, this measure was particularly relevant, first because it was a long time demand of housing advocates, but also it's one of the most contentious topics around housing reform, and it did generate a lot of debate, and is still in some countries, and this is the case of Ireland, people are still debating how practical it is, if this is going to be possible in the future. The fourth and final measure is mortgage repayments break. And this was implemented mostly for homeowners that they had a mortgage. So it included in most of the cases something that was called debt holidays, which means the suspension or only the partial payment of the monthly installments. So some countries that implemented those, there are Lithuania, Italy, Germany, UK, Slovakia. And it was interesting to observe that in nearly all cases where it was being implemented, it was the banks who decided to implement, to impose or to offer these mortgage moratorium, not necessarily the government. They were acting under the advice of the national central banks, but it came from them on an individual basis. So you had in the same countries, banks who would offer and some that would not. So it really depends. But there is a catch on this, which is even where banks would allow people to defer payments or to suspend payments, interest was continuing to accrue. So it was still added to the principal loan to be paid back post-pandemic. So it was just a matter of postponing the payment. So, and that negotiation and that renegotiation wasn't necessarily available to homeowners. So here I have a table showing just a summary of the policy measures, the main ones targeting tenants, homeowners, and people experiencing homelessness, and the countries who implemented them. So it complements a little bit the first graph I was showing you. And the underlying countries, they show the measures that were applicable only to some local jurisdictions, because some of them they were done at the national level and others only at the local level. So it gives more details in terms of who did what. So I think it's at least more or less clear by now that several countries, they did commit themselves to protect the right to housing, or by offering those, by implementing those house measures, and that the COVID-19 crisis did presented important opportunity to accomplish some housing objectives that had been demanded by housing advocates for many years. And in fact, it could set a precedent to embed the human right to housing even more into national legislations on one hand, because again, it was something that has been being demanded for by housing campaigners for many years. But on the other hand, it is also clear that those temporary measures, they were just temporary by nature. So, and it was only because they are temporary that they were possible. In a different context, they would probably, very likely, not be approved. So here I just want to mention some of the shortcomings, because it's no surprise to anyone that those policies, they do have some or several shortcomings. So I just want to touch very quickly on the central issues with those policies that were implemented. So for example, it was really great that people experiencing homelessness, they had access to shelter during the lockdowns, and sometimes in individual bedrooms, but those, they are not substitute for more permanent homes. So it's really important to highlight those were that they were very temporary responses and not necessarily part of a housing policy, although some of them could be in the future perhaps turned into a more long-term policy by providing permanent homes to people who are, or families who are homeless. So, and also the conditions in some of those shelters, they're far from ideal. So for example, we have cases where people are staying in soccer fields in South Africa, in Pretoria, and also people who are staying in open air parking lots with social distancing markers in Las Vegas, for example. So this is not ideal. And there are also reports from France and Italy about people receiving fines for sleeping on the streets during lockdowns. So those actions to protect people experiencing homelessness, they were very localized and only providing the bare minimum as a response to to the crisis. About the eviction ban, this temporary halt on evictions, it was not followed by options to repay rents in installments, for example, not even the renegotiation of the debt. So in most cases, tenants, they're left to deal directly with their landlords, and especially for people who are renting and they are leasing from international corporations, which are faceless, there is no human contact. So it's even harder to have access to that renegotiation because of the power imbalance. So we, and also we had reports of landlords who were serving eviction notices during the pandemic. So in the end, it was not a complete ban and it didn't apply for anyone who actually needed to be protected or to people who need help to stay in their homes. So about mortgage repayments, this was an important challenge for homeowners with a mortgage to keep up with their mortgage repayments when they had reduced an income or even lost their jobs during the pandemic. So this is very different from the credit crisis of 2007, 2008, which essentially struck homeowners and it led to home foreclosures. So this is different as well because the COVID crisis affected rental households and homeowners more widely. So especially those who are in low incomes. So this temporary suspension of payments did happen, but it was with interest capitalization. So in the end, even if they're allowed to defer the payments, the banks still made sure they would get their profits. So generally, there is no renegotiation of that. And homeowners were still expected to keep up with the same level of payments without considering how their income changed. So this is very similar to what happened in the with people renting in the private sector, because they can face foreclosure and lose their homes and be evicted. And an additional point here is that some countries, they did not implement measures to safeguard people's rights to housing during the pandemic, either because policymakers, they understood that their social safety nets, they were sufficient to cover citizens' needs during the crisis. It was the case, for example, of Iceland and Denmark, which they already have very low levels of homelessness, or because some national governments, they're not able to agree on housing pandemic interventions that, or they're not fast enough or just too slow to provide any emergency housing legislation. This was, for example, the case of Chile, where policymakers took a long time to agree on which kind of benefits they would offer, and then nothing was approved. So just to my conclusion and my final remarks. So the COVID crisis shows that the quick introduction of legislation to act as a buffer to prevent households from losing their homes is possible. This happened, but they do not address the more deep-rooted structural insufficiencies of the housing systems. So even from a human rights point of view, because the human right to adequate housing is not temporary. Housing is a constant human need. So more public investment in social and affordable housing is needed to guarantee the right to housing in the post-pandemic scenario is protected. And states should champion investments in affordable housing and turn all that energy, that impetus for short-term coronavirus changes, and turn those policies into long-term ones. So my fundamental proposition here is that housing and homelessness policy could be built back better. So in a sense that when a disaster happened, and this is something that the UN, this idea of building back better is something that the UN has been pushing. When a disaster strikes a country, for example, and people, they have to rebuild. So here my point is that after the experience with COVID, governments could create policies that they can be more effectively guided towards long-term housing solutions instead of only very localized ones because of a health crisis. If this happened, not only could the risk for COVID be reduced, but also the risks of negative health outcomes related to the lack of adequate housing. But we already know that most of the measures that I'm presenting here today have been lifted because they are time limited. So, and even if there was some expectation in the beginning that they would stay, they didn't. But in any case, I think those results there are not entirely discouraging because we know that those temporary policies, they worked and they helped people to stay in their homes and to keep them safe. And in some cases, we keep them healthy. So we can argue for them to stay. So, and I also think that this is a new area of studies for housing researchers that they may consider in the future, which is a new research direction that look into the impact of the pandemic on housing systems. So just to conclude with a quote from Balakrishna Hadjagopal, who is the UN's Special Rapporteur on Adequate Housing, just for us to think about what happens next. And he said, what is needed now is the political will to turn temporary measures into more permanent solutions that ensure the protection and realization of the right to adequate housing for all. And that's all from me. And thanks a lot for your attention.